the congenital heart disease and the specific appearances in the X-ray. First of all, we need to study about classification of heart disease. It is cyanotic and acyanotic. In the cyanotic ones, basically we can remember with the letter T. Most of the causes are starting with the letter T. It, in the first category, it is decreased pulmonary flow. Decreased pulmonary flow means oligemic fields will be there in tetralogy of Fallot, tricuspid atresia, and other univentricular heart with pulmonary stenosis. And increased pulmonary flow will be there in the transposition of great arteries and total anomalous pulmonary venous return. Means here the pulmonary fields will be more brighter. Decreased pulmonary flow in tetralogy of Fallot, tricuspid atresia, and other univentricular heart with pulmonary stenosis, and increased pulmonary flow in total anomalous and transposition of great arteries. Then are acyanotic heart disease. In acyanotic heart disease, there are two types: left to right shunt lesions and obstructive lesions. Left to right shunt lesions will be there in ventricular septal defect, atrial septal defect, atrioventricular septal defect, and patent ductus arteriosus. And obstructive lesions. Obstructive lesions which come under the acyanotic category are aortic stenosis and pulmonary wall stenosis and coarctation of aorta. Aortic stenosis, pulmonary wall stenosis, and coarctation of aorta. So we have seen the basic classification of the congenital heart disease. We need to remember which of these are the cyanotic ones and acyanotic ones. Next, we see the X-ray appearances. First one is endocardial cushion defect. Endocardial cushion defect has got gooseneck sign. Okay, gooseneck sign. We just need to remember the name for the entrance examination. The mechanism is vast behind the appearances. So that need not be remembered now for this time being sake. And we only remember the names. Endocardial cushion defect will give gooseneck sign. Transposition of great vessels. Transposition of great vessels was on the cyanotic side. Cyanotic side with the increased pulmonary blood flow. So we can see in the X-ray the lung fields are brighter, more whitish areas. Okay, and it gives transposition of great arteries, give egg on string sign. Egg on string sign. Then is partial anomalous pulmonary venous return. Partial anomalous gives scimitar sign. Scimitar like sword, something is scimitar, and it gives scimitar sign. It is also visible in the X-ray. Then total anomalous pulmonary venous return. Total anomalous is snowman sign. Snowman sign. Okay. Then is tetralogy of Fallot. Tetralogy of Fallot, classical boot-shaped heart. Boot-shaped heart. Tetralogy of Fallot was also on the cyanotic side, but it was oligemic. Here the lung fields are not as that brighter. In the total anomalous also it was brighter, and in the partial also, and in the transposition also. Then we have Epstein anomaly. Epstein anomaly, classical box-shaped heart, and it is due to lithium. Imagine a box full of lithium tablets. Okay. Then we have aortic coarctation. Aortic coarctation gives figure of 3 or reverse figure of 3. Aortic coarctation, how we will remember that if the tube is compressed from between, then it will become in the shape of 3. So figure of 3. Okay. So that are all the signs. Let's just quickly revise them. Aortic coarctation, figure of 3 or reverse figure of 3. Lithium box-shaped heart, tetralogy of Fallot boot-shaped heart, total anomalous snowman, and partial anomalous scimitar sign. TGA, transposition of great vessels, is Egg on string signs, great vessels, EGG. And endocardial cushion defect is gooseneck sign, cyanotic and acyanotic diseases. So that's all for this topic. Hope it will be helpful to you. Thank you.